I am Rifat, your TA for this course, HSPM 712, and here this is a discussion class, sort of tutorial class, and I am going to discuss all the questions in quizzes, 2 quizzes and 2 homeworks, and hopefully we can discuss about the topics of and concepts of economics that has been covered up until now in the course, and we will try to figure out how to do the maths and those formulas in economics and draw the graphs and these policy changes. All those that has been done in the course, and we will again go over it, thus we can have a good midterm exam and finally the final outcome, a good grade. So that is the objective. So now, so first topic is the marginal benefit. That was in the first lecture, I think. That is this allocation of money between 2 programs. So that there was the marginal benefit rule. We have to know actually what is actually the marginal thing. Marginal is it can be benefit, it can be cost. Later we have found that marginal cost. Later we have heard about marginal utility. So in economics, marginal means say marginal cost. What is the cost for an additional amount? So you have 10 units of pen, this marker, and it costs you $100. So 11th unit cost you total $109. So what would be the marginal cost? Here is the marginal cost. Marginal cost would be to produce the 11th unit of this pen, you require $9. So this is the marginal cost. What is the cost of producing the additional amount? It can be so what would be the cost of producing this 12th unit? That is the additional unit. It is $8. So marginal cost is the cost of this additional unit. So if you have marginal benefit, so what would be the benefit of investing $1 additional dollar? If it is the marginal utility, what would be the utility of consuming 1 additional good? Say utility is another thing that has been discussed. Utility is a satisfaction we are taking out of consuming a commodity. So if I take an orange and it gives me say 10 level of utility, it is called utils. That is totally a psychological thing, and economist comes up with these kind of assumptions, as Dr. Khan said. So if one orange gives me 10 utils of utility, then second orange gives me 8 utils of utility. So my marginal utility is 8. Third orange gives me 7 utils. So what is my utility? Marginal utility 7. So what is the outcome of this additional investment, this additional production of this additional unit of good and or additional units consumption, what it gives? So everything in economics, marginal means the additional thing, what it gives or what it costs some additional unit. So marginal cost is calculated in this way. This delta, small delta, means small changes, and in DTC, TC means total cost. Total cost, change in total cost due to change in quantity. Simple. Change in total cost due to change in quantity. So each additional quantity, maybe there is 10, 11 minus 10, I can found this del q, and what was the cost? 109, I put that, and 100. So 9 1, I put this in 9 1, this marginal cost MC equals to 9, right?
So that's marginal quantity equals 11 minus 10.
Yeah.
Marginal,
But we cannot put in this way, because it is a, we cannot put this differentiation, this change in quantity, because it is the change in quantity is the additional unit. If it is 1, it is all right, but it is done by calculus, this differentiation. If you don't know calculus, if you can't remember calculus, it is not required in this class, but it is just the idea. You have to differentiate total cost in respect of quantity. In differentiation, we find that change in total cost or change in something in respect of something, small change in something in respect of small change of another thing. So here the calculus thing comes in, and we calculate marginal cost or marginal. If you put this marginal benefit, here would be the total benefit, whereby del, instead of q you will put the dollar amount. So additional dollar amount puts you what amount of benefit. So this is the marginal thing. Any question? Any question about this marginal? Then I will forward to another topic.
Why don't you give me an example and let them work one through and see what happens?
Okay. So there are examples. I will go through the topics, and then what will work for good for you, going pertinent questions after discussing okay. So
Can I ask a question?
yeah.
So in the beginning, you were saying that we're going to have marginal benefit, marginal cost, and marginal utility.
Yeah, these are, yes,
But they're not the same thing. Those are three different
things. Yes.
things. Right
Yes.
now our focus is marginal cost, which is
Yes, the three different things, but I mentioned about this marginal. Everything you can find the similarity. The additional unit in economics, it is about the additional extra amount of thing, extra additional unit of thing. What gives me, what costs me, and what gives me any additional utility, or what gives me the additional benefit. So this is all about this additional thing.
okay.
So
Making sense.
there is a question in, what is the question? You can tell me where is the marginal benefit question?
Homework one.
Homework 1, okay. Yes, marginal benefit. Here there were two programs. We have to allocate money between these two.
What number on homework one?
Homework 1 3. Yeah. So for $5,000 expenditure, benefit of $40,000. For $10,000, benefit was 60,000, and in this fashion. So what is the marginal benefit? What is the marginal benefit for second one? Leave alone the first one. For the second one, tell me what is the what will be the marginal benefit per 100,000, let's say, per 1,000, sorry. Please, anyone. This is the benefit, and these are the expenditure or investment. So, change in what? Expenditure is 5,000. So, I am investing 5,000 and getting benefit of 20,000. So, this additional 5,000 gives me this 20,000 of additional benefit, right? It is 20,000 over this 60,000. So, we can see that this 5,000 gives me this additional 20,000, right? If we have 15,000 and here is 80,000, we can see that there is also 20,000 increase in benefit for 5,000 increase in expenditure. So, if we divide it, we can find that 4 is the marginal benefit. For each dollar expenditure, we are getting 4 additional dollars of benefit. So, this is the marginal benefit. Now, you will say what will be the marginal benefit of this one. This is the second strategy in your question. Tell me what will be the marginal benefit in that case. Just calculate and tell me. You are going to do this. It is easy. You cannot do it by hand. You can see it and work through it. Tell anyone. Please volunteer. Or This one is 5,000 increase, and here is the increase of 70,000, right? So, what is the additional dollars benefit? 5 divided by 70, we can find that 14. Then for this one, then what is the marginal benefit for in this case? Tell. What is the increase? $50,000. Here is the 5,000. So 10. Rick is being impatient, and he is telling that why. Please speak up, otherwise I cannot understand whether you are getting it or not. It is not that difficult, it is easy, right. So, for the first one, as there was nothing beyond it, so we will assume that 5,000 is the initial increase from 0. So, 5,000 and 9,000 was 0, for 0 it was 0. So, here it would be 90,000 divided by 5,000, and we will count the additional marginal benefit. So, marginal benefit would be 18. Here we can see that here for the initial instance, we start from 0. We
did 90 divided by 5.
Yeah, 90,000 divided by 5. Yes, yes. So, for the first one, here it would be 8. Now, for allocation between two programs, we have to see the benefit, which program gives me more benefit, and we will benefit into the in between those two programs when those marginal benefits are equal between these two programs. That amount will be our target. So, here it was found that this was fairly constant over the investment, and for this question there were at first you have $20,000, and best possible way was all the dollars can be should be invested into second strategy. Or here it was tricky in the sense that for $20,000 you are getting 250. Please tell what would be the marginal benefit, and here it is not required. We have $20,000 in total. We are allocating in between these two strategies. So, for this, what is the marginal benefit in this case? 8, right. So, here we can see that there is no equal marginal benefit that can be divided between these 20,000. So, 20,000 should be invested only strategy 2, because there is no equal benefit, marginal benefit between them. But we accepted the answer of this 15 and 5 dividation, because it was, if you can remember that, we also accepted that. But in true sense, in marginal benefit allocation through marginal benefit, by following this marginal benefit rule, that is not the case. 10 here, it is 8. So, we can see that this program is very good, because it is fetching us 18, 14, 10, 8, and it starts from only 8, then stuck into 4. So, we can invest all the money in that should be the actual answer. And for the second part, there were 75,000, and there we see that 4 is fairly constant all over the investment tier, and on the 30,000 expenditure level we found that 4,000 was a marginal benefit. So, we will invest 4,000 in strategy, 30,000 in strategy 2 and 45,000 in strategy 1 to equal the marginal benefit. We are getting marginal benefit 4, equal number 4 marginal benefit from strategy 1, strategy 2. So, we should find out the point of equal marginal benefit. So, that is the marginal benefit. Now, I am going to elasticity. Is there any question about this marginal thing? Anything?
So
Please.
okay, so I'm just kind of going back. So for that 8 that you have at the end, so for the 15, so we did the difference between 20,000 and 15,000. Okay, and you also have the difference between 250,000 and 210,000.
Right.
So we're looking at 40,000 divided by 5 to get the 8.
Right. Yes, that's the case. Oh, please.
Are we allowed to, I mean, for the first question of the examination, are we going to be using marginal benefit for that one? Is that the concept?
Well, for which one?
For the question 1 where it talks about the physician salaries.
Yes. That
Marginal,
yes. You can also answer that question by that way. Whenever marginal benefit is equal, you can allocate your time between those. So, marginal benefit actually tells you that normally there are decreasing return, diminishing marginal return in all cases. Whenever you eat an orange, the second orange does not give you the same level of satisfaction, because you have already an orange. So, whenever you go to the third one, you are getting a further less amount of satisfaction. In case of production, that is also the case. Up until some point or level, you are getting increasing marginal output. Then that point, beyond that point, you tend to find that there is diminishing return. So, marginal benefit in that sense is always diminishing. But in that question, if I can remember, there is a quadratic equation. There is h square and h. So in that case, I think you should find this diminishing return, and in other case it would be constant return. That was also in the question, homework question, clinic and hospital thing. There was the same type of question, and you can answer that question by this marginal benefit paradigm, that we are going to allocate their time up to that point, or for maximization I will work for up to that point where it is the marginal benefit is higher from that clinic one. I am getting more out of my hospital duty, so I am going to do the hospital duty. When there is a decrease, say if I can remember, in the question there was $30 from each hour of clinic, but hospital hour starts from 100. Then when it goes beyond 30, let us say 29, I am not going to work in the hospital anymore. I will devote the whole time in clinic. So when marginal benefit goes beyond, so I am going to work up until that point, 30 equals to 30. That is the maximization problem. In the maximization problem, I will work 7 hours, that in the question 6 hours, 7 hours in the hospital, and when marginal benefit goes down than the clinic one, then I am stop working in the hospital. I will go to clinic for the next 3 hours. That was the answer.
So basically, in English, it's like okay, once I'm not really getting anything from working in the hospital.
Not getting anything. I am getting something.
You're still getting something, but you're not getting. It's equaling the same amount as.
I am getting less than the amount I can get from the clinic, working at the same time.
Okay.
This is the same. We are all economists in our daily life. If I am not talking about this class and this thing, if I can in real time I tell you that you are going to pay this one, you can find that. Yes, I will go for there for 7 hours, then I will go for that, because then I am going to start earning lesser and lesser amount. So I will go for clinic, then I will go for clinic. That is the way. It is telling in economic way that marginal benefit or marginal outcome is maximizing the outcome. So I think marginal, we are done with marginal thing, right? We will go to the marginal thing again in case of this second homework last question, the marginal benefit cost curve, and we will go to that again. But then I would like to tell about something about elasticity. Like marginal, elasticity is another basic concept of economics, and here for elasticity, any kind of elasticity, we are looking at the changes in quantity demanded. Here is the graph, the one and only universal graph of economics, supply and demand curve, this one demand, this one supply. So here is the price and quantity. Change in quantity demanded due to change in price. There is a first we tell the price elasticity, but elasticity can be anything which affects the demand of quantity of any commodity. So income elasticity, you can have elasticity. In the question there was population change elasticity. So any factors which is affecting this demand, quantity demanded, that can be put in the elasticity. So we are looking at the changes in quantity demanded of any good due to changes in any factors of that quantity of that demand function. So their price, income, their tastes, individual have different tastes. So taste is a important economic factor, and then population change, aging, There are many factors. Then there may be gender bias, male chooses something, female doesn't, in that way. So, here in that question there were 3 elasticity, mention about 3 elasticity. We are now looking at the elasticity formula, or what are the equations and name of elasticity. So, price elasticity, for price elasticity we are looking at again we are telling that percentage change in quantity demanded. Here look, it was the initial quantity. We start with one quantity, and delta Q means changes in quantity demanded from the initial one. For initially say we want 100 unit, now we are demanding 90 units. So, change in quantity is 10, right, and Q should be the 100 one. We calculate the percentage change in relation to, in respect to the initial number. So, initially it was 100, so Q is 100, initial quantity was 100 and del Q by Q, this 100 is cancelled out. So, normally we do not write it this 100, and del P is same. Initially there was a price, we want this amount of quantity, and let us say this one P1, this one P2, Q1, Q2. So, there is the price change is P2 minus P1 divided by P1. It is actually saying this, the percentage change in price. So, elasticity is looking at the changes in quantity due to any other factors. So, what about income? Changes in quantity demanded due to changes in income. Now, I will like to say about this income change, normal and inferior good, that was mentioned in your lecture. It is related to income. When a good is normal, if income changes, the demand for that good also increases. So, any kind of luxury goods like say television or that kind of good, it is normal good. Whenever you have more income, you are going to buy this. Whenever you less income, you do not need that. So, it is normal good. When income increases, your demand also increases. But when it is opposite, income increases and your demand decreases, then it is called inferior good. These goods are for the poor. They actually forced to consume it. Whenever they have more money, they are not going to buy it. So, in economics, maybe there is the, have you heard about corn? I do not know corn, whether corn is primarily consumed by US people, but if say whenever they are poor, they have less income, they are going to buy this corn, and whenever they have more income, they are going to buy rice more. So, then the demand for corn is decreased whenever they have. So, corn will be the inferior good and rice will be the what? Normal good, right. With increasing income, rice's demand is increasing, and with increasing income, corn's demand is decreasing. So, whenever there is a decrease in demand due to in case of increasing income, that good is called inferior. So, there are other two types of this cross elasticity, own price elasticity. Own price elasticity means this commodity's own price elasticity, that it is only dealing with one commodity. That I am telling about, let us say, this primary care visits. It is many times mentioned in the question. The primary care visits, if primary care visits price increases, what will be the change in the primary care utilization? That is quantity demand, but demand for primary care utilization. So it is in relation to own price of the primary care. But when we talk about that, if primary outpatient visits price is increased, what will be the effect on the hospital care utilization, inpatient care utilization? So we are talking about one increase, and that affect, how that affect the other commodity, that is related commodity, not increasing price for outpatient visit and increasing what is the effect on coffee consumption. That not that case, but related goods, they are related in nature, and they can be complement or substitute to each other. So I am getting this substitute or complement thing. So in economics, there are some, whenever there is a price increase in coffee, we tend to buy more tea, because tea is a substitute. Tea can produce same kind of utility in economic term, same kind of satisfaction that coffee gives us. So coffee and tea is substitute, but whenever I am talking about this increasing price of coffee, what will be the effect on sugar? I am not going to eat sugar instead of coffee. I am going to eat sugar with coffee. So these two are complementary goods. So complement goods, there should be, when there is increasing price, we know that decrease in demand. So we are going to see what would be the effect on sugar due to increase in price of coffee. Then we are calling it cross elasticity. If we put the demand of other good in the numerator, that changes in demand for sugar, and in the denominator we put that changes in the price of coffee, then we are talking about the effect of increasing price of one good on the quantity demanded for other related good. So that is the cross elasticity, right? There is the cross CROSS, cross elasticity. Cross elasticity.
Do you mind going over number 2 in the homework?
That's part of the exam. I will not answer any direct question related to the exam. I will try to answer your any queries related to your concepts, and you can for
Not the midterm.
sorry, which one?
I'm sorry, the homework that we
That we
just
turned in
turned
last
in.
night.
Yeah.
The
Number 2. Yeah.
is that okay?
Yeah, I will go to that. Yes.
But you can talk about the midterm number 2 if you want.
Yes, I can go to that, but before going that, I will tell about another thing that is called arc elasticity. Arc elasticity, I am not going to the for arc elasticity, there is a curve. If this is the curve, that is arc, just like arc, that is not the linear, this curvilinear. So for getting these points average number, we tend to, this is fairly in the middle, we tend to get the average of these 2 points, right? So in arc elasticity formula, you will see that P del P by P1 plus P2. Instead of one single price, P1 by P2 divided by 2, we take the average of 2 price. two prices to get the average price. So in the numerator, Q1 plus Q2 divided by 2. So in arc elasticity formula, whenever there is arc elasticity, there is the we can think that the curve is not linear, it is curvilinear. So getting average value, we tend to average the 2 points and get the average value for that. So this is the formula. Now I am going to the question of number 2, that was related to elasticities, and there we can see that in the first what was the elasticity of price? Minus 0.2, right? What was the changes in price? 10%, so minus 0.1, and for each and every elasticity we are going to find the what is the change in the quantity demanded. So if we cross multiply this one with this one, we will find that 0.02, both are negative, so there is positive change of 0.02 or 2% positive change in quantity demanded. For the second one, the income elasticity, in the same fashion you will find that quantity changes in will be 0.3 into 0.24, 0.072, and for elderly population, what will be the? You have done your homework. You can tell me what is that? 0.6 into what? I am 0.21. So we can add all these three, and we shall find that a total number, and there was price in 2003. If we multiply with this, we will find the changed number, changed price in 2003 price, because we are dealing with 2003, and then we can add it and with this one, then we can get the 2003 price, the total 2003 price. And for CPI, that is consumer price index, it captures the inflation. Over the, we know all about that today's $1 is not the same for tomorrow, it will be less because there is inflation. So CPI index actually tells that in 2003, if the price of one commodity is 184, in 2013 it was 238. So what will be the price of this one in 2013? You say we can do the math, and 2038 by 184 into this one, we can get any figure in 2003 price converted to 2013 price by this formula. CPI is the index which takes account many things, prices of many commodities over the years, and from a base year they calculate the, if this year one price is $100, then next year what will be the price, due to many factors. There are many factors in economies. You know, in 2008 there was recession, then 2009 it was fairly the same effect of recession was there, and in 2012 it gradually diminishes the effect of. So there will be change, and taking those into account, these figures are calculated, and we can use this one, that is given in the question. So I went I went through this very quickly because fixed cost and average variable cost, and we can see that in the total revenue curve, that is fairly starts from 45 degree and diagonally goes up. So there is a point, before this point revenue is less than cost. So, no firm, no producer will operate from here to here, they will start from here, they will not operate in here because it will be a losing concern. So, you have to start from here, that is the reservation price, and you will operate until that point. Look here, the total cost curve bends, and then again after a while it starts increasing. So, at the point where the margin is the highest, beyond that point their marginal cost will increase. Again we are getting into the marginal thing. I am wishing to get into this marginal thing, that is why I am mentioning this one. So, marginal cost, whenever there is marginal cost increasing, then we are going to stop. So, we are going to operate in between these 2 points. This firm will operate in between this point. Beyond this one, they are going to lose their already earned profit. Their marginal cost increasing means they are getting less amount of money for producing additional amount. So, they are losing from their already earned profit. Now, we are going to find that how we can find this total cost curve, marginal cost curve from a total cost curve. If we can, we are drawing this from this figure to this figure. Total cost curve, when there is a total cost, we saw that total marginal cost equals to an average cost is total cost divided by quantity. It is simple. You produce 100 number of units of product, and it you cost you $1,000. So, average cost is $10, but marginal cost is not that. You cannot count that in that way. You have to count that what is the cost of 999th unit of that product and 1000th unit of product. So, we find the marginal cost from this figure, that is given by this equation. Small change in quantity gives you what change in your cost, total cost, that is can be found from this slope of this curve. Slope, you already learned about regression equation many times. We saw that in regression equation there is a it is called slope coefficient, this beta 1. This beta 1, this slope coefficient means what of 1 unit change in this independent variable x 1 will bring what amount of change in dependent variable y. If it is 0.2, as we have seen in the complement equation, that if the complement and substitute equation, coffee and aspirin, there was some beta 1, this slope coefficient, and if x 1 is increased by 1 unit, that is 1, it will give us 0.2 unit increase in y. So, slope coefficient means this marginal increase. So, it is marginal cost, it gives us the marginal figure. So, if we take this total cost curve, there is a point, in each point we can draw a curve, linear curve, and calculate the slope of that curve. In each, sorry, that should be tangential, and the slope of the curve will be the marginal cost curve. From this one we can draw, from every point we can draw a marginal cost curve that will show like this. And for average cost, we will draw from 0, that is the starting point, we draw a straight line connecting these 2 points, and we will take the slope of that that will give us the average cost. So, average cost curve will be like this one. So, this is marginal cost, this is average cost. So, at first marginal cost decreased gradually, and it also decreased the average cost, pull down the average cost, and whenever the marginal cost increases, it also pulls up the average cost, right. So, when marginal cost is increased at that point, you can see that it is not aligned, but at this point this firm will operate, the firm will produce from this point to this point. So, this is only this portion of the marginal cost curve signifies the supply curve of the firm. So, marginal cost curve is the supply curve of the firm, only that part that corresponds to the operating zone, that part. Beyond that part they will not operate, right. So, we have to find this marginal cost curve in this fashion from this total cost curve, and then the supply curve of the firm. Got it, or getting difficult? The simple mathematical thing, you have learned it many times in your geometry thing, that slope of a curve, we have to draw a tangent and then have to take the slope of that tangent, that is the slope at that point. And average cost, for average cost we can at this point and take slope of that point, say slope of that curve, that is linear. So, we can have the average cost curve, or if you take the quantity and divided by total cost divided by total quantity, you will get the average cost. Average cost is not that difficult, but both of these is not that difficult because it is simple and the first equation of differential calculus. So, we have to do the calculus thing, differentiation for marginal cost curve, and just simple dividation. I went over and over again to yourselves, and I think it fairly sums up, and we actually going to post the explanation, the answers, so you can find that there. So, I think it will not be that difficult, but there are few other things I have to there was a question about log. Do you know how to do log? What? Log. Yes, you can take log in the Excel sheet and it will give you the log of anything. And there are two kinds of log, one is 10 based log, another is natural log, that is E based log. That is one thing. You take log of something, that will gives you a decreased number. So, whenever there is a big figure, we tend to decrease it by log, taking the logarithm of it. And when we have found a logged value, what we do to find the normal value? What is the reverse process? Anti-log. Yes, anti-log, that is exponential. Exponential is reverse process of. So, exp is the command in Excel, exponential short form, that is anti-log. Yes. So, there was a mention of log. I am mentioning it because I think it is important to learn. This log thing is taking log, log, that is a command in Excel, and then exp in the that is the command in Excel. You can do that, and remind that log is used to make a big figure into smaller figure. And there are other factors, that if we take log, we can find this elasticity directly. That is another utility of taking log. So that is a higher thing. We are not going to that thing, but it's definitely good to learn, good to have some more knowledge. Now, sorry. Yes, one log that was mentioned in the class, that log, how to take the log, and you can have a demand equation or supply equation that may have log. So you have to calculate that, and that's why I mentioned that, to refresh your memories. And complement substitute, I covered this one. Market equilibrium, the main thing, and you know about discounting, how you do the discounting. I didn't see anyone failing to answer this one. Discounting, how to do the discounting. Discounting, you can do that. Okay, discounting is fairly simple. So for market equilibrium and change in the demand, and here is the last question in homework 2. There was a equation that demand equals to 2p plus for 25,250. So 900 minus twice p. I am going to the second part. You can plot. I think you can plot P and Q. If you have the Excel sheet and you just take different prices and get the quantity of at different prices. But if we draw this graph roughly, then for 0 price, what will be the demand? 900. If the price is 0, if we plug 0 in it, then we find that demand is 900, right? And here for 0 demand, price should be 450. At $450 price, there will be no demand. So we can find the 2 points and draw the curve, and we found that there is a mention that 500 is the need for the community, is the need, not demand. What is the difference between need and demand? Tell what? Demand is defined by the market, that is at the market price, and market is defined by the supply also. Market is not defined only by my requirement. So for effective demand, there should be my money in my pocket. I have demand is not that thing that I required that, but I have to have the willingness to spend money for that. First one is want, or my requirement, that I want that, and then I have to have money in my pocket, and I have the willingness to spend the money on that product. So effective demand comes from these three. You have to satisfy 3 criteria, otherwise that is not demand. But there should be medical care for me. I am ill, I am very much sick, but I don't have money, or I have money but I don't want to see any physician, I don't believe in a physician. So I have the need, to see a doctor, but I don't have the demand. Maybe I don't have the money, maybe even I don't know that I have to go to the doctor. I don't know. I don't even have the knowledge of that I have a disease and I have to go to doctor. Please.
So the 3 things that, what are the 3 things that?
One is want, that is I have to know that I require this thing. Second thing, money, or certainly I have to have money in my pocket, wealth, that is another way of telling that, and willingness to spend. So 3 W's, I have to have want, then I have to have money in my pocket, wealth, and final, last but not least, I have to have the willingness to spend that money. If I don't have willingness, if I have the requirement, I know that I have to consume that good, I have the money, but I don't want to, I don't feel that I should buy that. So demand, to be a effective demand, three essential criteria. But here need is, it is required. I even don't know, but anyone else know that it is required, it is need. I don't know, I don't understand. In the poor people, that is the case. When in USA, for uninsured people, that is the case. I know, but I don't have the means to go to take utilize the care or take have the care. So need is there, and in case of need, we know that for fulfilling this need, if we can plug this 500 here, what would be the price of each consultation? That is 200, right? So for fulfilling 500, for utilization of this 500 outpatient visit, the money should be market, the price should be $200. And we find that there is a mention that outpatient service price, the market equilibrium price, that is not told here, but if there is a market price, it is told the market price is 300. At $300, what is our demand? 900 minus 600, that is 300. So at the present market price, we are consuming only 300. So this 200 for utilization of more 200 more visits, we have to reduce these by $100, right? That's the case. And when there is a need thing, that is, we have to have 500, not more than that. There is a vertical inelastic curve, because beyond that we don't require anything. If it is provided, we will not consume it. Now for this question, we can subsidize this $100 directly to the consumer, not to the physician or hospital. That will change the dynamics of the market. That will not directly change the 300 to 200. If we can give $100 to consumer and consumer put their rest of $200 from their own pocket and give that to physician, that will work. But it seems for a policy purpose, it is not very appealing, difficult. Yes, I cannot give $100 to any person and ensure that he will utilize this for this. He will buy necessary things. One who has this decree only $200, he has to buy many other things beyond this healthcare services. He will start buying those things. So this is not appealing, but it is called the market equilibrium price. So we are dealing with only the demand curve. There is a supply curve also, and that is my point. In every market, there is a supply curve and there is a demand curve. So market equilibrium price, there is a supply curve. Supply curve, we all know that this is upward sloping curve, and this is the supply curve. We can change the position of the supply curve. If we can change the position of the supply curve from here to here, then the new market equilibrium would be there, and this 500 utilization, 500 required number of outpatient services utilized. So, what are the policies we can adopt? We can increase the supply, not the demand side intervention. There are two kinds of intervention. One is demand side, one is supply side. Tell me, what are the demand side things in healthcare setting? What are the demand side thing? Sliding scale. Sliding scale for based on income for that is you are telling about introducing what do you think it is
Based on
demand side intervention or supply side intervention? Yes, based on income. I can understand that you are telling about the progressive type of payment, that one who has less income, he will pay less, and one who don't think. Let me tell you, it is the basic class. Don't think in difficult ways. Don't think it's a difficult thing. You have to, then this normal graph will not be the normal again. That is you put that? Okay. You think in a normal way that what can you do to change the scenario in a very much. Dr. Khan, I keep mentioning this one because without any further complicating things, you can find the solution from here. Whenever you put that, yes, we are going to put this equitable just kind of thing, that one who has more money will pay more money, that will not make this market. So, there will be more market, more kind of market. Well, there will be one market for these rich people, one market for these poor people, one market for these middle income people. So, there will be more market in case of one market. We are telling about one market. We are not going to dividing this in many market, because this figure is normal. This is the two dimensional figure. There is only one price and one quantity, and we are going to analyze one at a time. If we have another price at another equilibrium price for this high income people, then we are going to have to draw another graph. Then we can merge these graphs and merge these equations, and that is another case. So, I think I have covered the important points. And from this one, from market, there was a question that asked about excess demand, excess supply. We can go from this figure to that one. That was in the quiz 1 or 2. Yes. Here. Yeah, this one market supply and demand for number 7. Quiz 2 number 7. We have provided the explanation there. You can find the explanation. And
So this is
quiz 2 number 7. Quiz 2 number 7, there is the demand function, that 5000 minus 20f. Supply function was 2000 plus 30f. So, here it is that there is no out of pocket payment. You don't have to pay your out of pocket. So, what will be the demand? If you don't have to pay anything, your price would be 0, right? So, you put 0 here. If we put 0 here, the demand is only 5,000, and government is paying $100 to the suppliers. Suppliers are not getting 0, they are getting $100 from government. So, supplier has this $100, and suppliers at $100, they will they will produce this amount, right. They are producing this amount. So, there is equal, there is no excess demand, no excess of, that is the equilibrium, that is in equilibrium, equal, the demand equals to supply. So, if price is 0 and $100 is given by government, that would be the case, there will be no excess demand or supply. For kidney market, we can see that if there is a regulation that there should be no sale of this, no one can sell this one. So, if no one can sell this one, their price would be 0. At 0 price, look, at 0 price it is only 2000. Say this one is for the kidney market equation. For kidney market, organ donation market, there is the equation for supplier. So, this 2000 means they are willing to supply without any price. At 0 price, there should be at least 2000 kidney donors, they will donate their kidney. When there is a price, there should be some more. If there is a price is $100, then 3000 more kidney will be supplied. But if there is 0, this 2000 will be there. They are supplying their kidneys due to various reasons, they are not due to money. Without money, they will supply. And look here, if the price is 0 in the kidney market, there will be 5000 demand, and when there is a price is imposed, then the demand is decreasing, because it is downward sloping, it will decrease. So, from policy perspective, if there is no authorized buy and sell, there should be no price on this demand and supply. So, if there is no price, it would be 0, this will also be 0, but there is bar on only selling of, you can take money, but you cannot sell. You have to give money for taking kidney from intermediary. Dr. Khan told that intermediary organization who will manage this kind of transaction. You will give money them for this management, but one who sells, he or she will not get any money. So, their money will be 0, supplier will get 0, but there should be some price. So, this kind of policy scenarios can be given in your question, and you can, I think you will be able to answer those questions, right. Anything else? Anything else you think that is required? This you can see that this quiz 1 question 4, there is a substitute and complement thing. Look at the demand equation, that is 0.01 minus 0.25 P plus 0.12 P star plus 0.17 A. So, here Q is the quantity of aspirin and P is the price of aspirin and P star is the price of coffee. What is the relation between this aspirin and coffee? Look, when there is a price increase in aspirin, we can see that from this negative mark that there will be decreased demand for aspirin, right. There is increase in price of aspirin, decrease in aspirin, that is fairly intuitive. Demand curve is downward sloping. But what about the coffee? When there is increasing price, what will be the demand for coffee? when there is increasing price of coffee, what is the effect on aspirin? Increasing price of coffee, what will be the effect on quantity of aspirin demanded? Increase, yes, that's positive. The mark is positive. So, what is the relation between these two? Coffee's price increased, aspirin's demand increased. Just think about this coffee and tea thing. Substitute, yes, they are going to be substitute. That when there is increase in coffee, decrease in demand in coffee, but increase in demand in aspirin. So, we can assume that they are put in the same equation. Coffee, aspirin is substitute of coffee, and vice versa. That whenever there is increase in price of aspirin, we are going to get some more coffee. So, we can see from this figure, looking at the sign, whether it is plus or minus, we can say that whether it is substitute or complement, right?
Oh wait, can you say that again? So if it's negative, okay, say that one more time.
If there is increase in price of coffee, what will be the effect on quantity demanded of aspirin? Increase, because the price has a positive mark.
Asking about the symbol, does it tell you?
Yes,
Okay, so if it's plus, that means it's increased.
right.
Yeah.
When you put here 1, that is increased by 0.12.
Okay.
Then
But if
when
it was a negative, then it would decrease, right?
right, if we put 1, the whole figure will decrease by 0.25 because of this minus negative sign, right? So, it is negative effect, reciprocal effect, because we know that price, your own price has negative effect on your demand. It is increase, if it is decrease, inverse relationship, your own price decreased, your demand increased. Same way, if the price of aspirin increased, demand of aspirin will be decreased. But here we can see that if coffee's price increased, aspirin's demand increased. So, coffee's own demand decreased, and at the same time aspirin's demand increased. We have to think that coffee is less demanded, but aspirin is more demanded. So, we are substituting coffee with aspirin, right? But if it is negative, then there is a complement. We can tell that we take coffee and aspirin together. So, when there is less demand for aspirin, there is less demand for coffee also.